at home. She defied the rules.
I just want to thank everyone standing here for showing your support and love, because it honestly gives us the courage to continue this fight. It's exhausting and it feels sometimes like I'm hanging on by a thread. I'm still currently working right now, and probably after this I'll get canned, but my morals are not for sale. So to do the right thing, and I thank you ladies for having the courage to help me speak about my journey in healthcare during COVID. So my name is Jessica Ferroni, and I'm a registered nurse. I've worked in healthcare in Ontario and volunteered abroad over the last 10 years. And I recently just got back from Tanzania, volunteering in the hospital and doing community outreach programs. And I'm here today to share my concerns and what I've been seeing go down in healthcare while working during this declared pandemic. I'm here to hold my governing body, the College of Nurses of Ontario, accountable in failing to protect the public by silencing its very own frontline workers who are bearing witness to the negligence, abuse, and medical mismanagement during this pandemic. I hope our concerns will be heard and that we can find and work towards solutions to better serve and protect the public. Woo! Initially, in March 2020, we had no idea what the hell COVID-19 was and was capable of and who its main casualties were, so we took harsh precautions and implemented strict policies and protocols in society and moreover in the healthcare system. It has been over a freaking year now, and there's a lot of new data and information that is unfolded as it relates to COVID. We know that it has a survival rate for those under 70 of 99.98%. What the hell? Oh God, okay. And over the age of 70, including comorbidities with zero treatment and prophylactic care, the survival rate is 95%. So my question is, why are we still upholding these draconian measures, not only in society, but how we operate in healthcare? I am seeing the detriments in healthcare, and it is just, it's fucking devastating. Yes, I'm sorry. It's devastating. Why are we still following the old models and old science of the unknown when we know so much about COVID-19? My concerns are these policies and procedures being carried out in healthcare and in society are directly harming more people than COVID-19. Why isn't anyone listening to us? A lot of these policies don't even make sense and don't even follow evidence-based practice or the data or the peer-reviewed literature. For example, I work in long-term care, and healthy asymptomatic staff members have to be tested 3 times a week. Where is the data to support this? Like, I don't get it. It's crazy. And every time I call the Ministry of Long-Term Care, all they say is, well, we're just following public health protocols. What does that even mean? Why is no one having a conversation with us?
It's a dictatorship. Right.
Why are we even using a PCR test to determine someone's health instead of subjectively and objectively assessing them? We know how reliable is a PCR test with a threshold cycle of over 30. If you continue to test healthy staff members and base their health on a single tool, such as a rapid test, you're creating an even further shortage. Oh my goodness. It's ridiculous. So if a healthy staff member, it just happened recently, tests positive, do you know what happens in long-term care? They have to isolate, they have to go home for 2 weeks and isolate, and the entire home goes into isolation mode, which is even stricter than what they're currently being held in now. It's literally like prison. Residents are still unable to leave the home. Their activities of daily living have been taken from them. They're denied access to see their loved ones. And it's just really so unnecessary. How is this humane, ethical? How does this logic follow evidence-based practice? Not to mention, they've all been vaccinated. So what is the point? Yet they're still being held as prisoners. They're still encouraged to wear masks in common areas, which is negligent because they're not even fit to wear a mask. It is so dangerous. I am speaking here today because I should not feel threatened for wanting to know why these measures exist. And if it is so fundamental and follows science, why not just provide a rationale?
Draw us the science.
What's the rationale?
Another ironic and questionable measure is all staff must wear masks, face shields, full PPE no matter what. I'm not sure if people forgot this, but this was never normal to wear full PPE during your entire 12-hour shift when you're not in an acute situation that warrants it. It's a thing to wear full PPE when people are working with patients who are on contact droplet isolate precautions, but to wear it in the halls or sitting in nursing stations, talking to residents in common areas, it's just simply unnecessary and dehumanizing. This is their home. Imagine a confused resident and now you add all this COVID gear. Like, it is neglect, it's abuse, it's their home. This is where they're going to die and they're not even going to see their loved ones. I literally just had to call a family member the other day to tell them their loved one passed away unexpectedly, and she was devastated. She had not seen her mother in over a year. That is psychologically going to mess her up. She's going to have to live with that. Alright, so it's also interesting, I find it also interesting, in 2018 when influenza was a thing in the hospital, the major downtown hospitals created a vaccine or mask policy, which meant during influenza season you either had to wear a mask or get vaccinated. The Ontario Nurses Association filed a lawsuit against this policy after deliberation in the court ruled in their favor because they said it is illogical and irresponsible, and it is the exact opposite of being reasonable because there is scant literature and evidence that forcing healthy workers and nurses to use masks reduce the transmission of influenza. Not only am I seeing a significant decline in the health and well-being of long-term care residents, it's apparent that suicide, overdose, strokes, abuse, and child and adolescent anxiety and depression are now flooding the healthcare system due to all the public health mismanagement of this pandemic. I will not be a silent witness to this crisis. I am holding you, the College of Nurses, public health, and the government accountable. There is so much blood on your hands, and you need to start having an open discussion with your frontline workers. We are begging you for open dialogue. That's all. We just want to have a conversation. You need to educate and inform the public with healthy tools and ways that will decrease their risks. Using fear tactics and not calm, objective information to give people tools to make informed decisions, that is what you need to be doing. The risks of, we know that obesity and vitamin D deficiency is a direct, huge risk factor, and instead of promoting health and teaching about preventative health, your solutions have been to muzzle your frontline workers, lock down the province, prevent people from accessing care, and use fear tactics tactics in the media to scare them. And how are people supposed to access proper care? This is not okay. We are not COVID deniers. We are advocating for everyone else who is being affected by this pandemic. It's not a matter of COVID anymore. We're asking you to open your eyes and to see the negligence and